Hello, I'm Dr. Inman. This is a miniature lecture on what we call collateral health. An interesting phenomenon occurred when we started using laser therapy. We would bring an animal in and for some reason, we would laser these animals for usually musculoskeletal problems, essentially. And on occasion, the client would hold on to their animal or hold their animal in their arms as we would laser them. Now, I don't recommend that an animal be held by the owner, essentially. Cats can sometimes, this happens, because the owner can be injured, essentially. The only malpractice suit that lawsuit that the veterinarian ever loses is an animal who actually injures their own owner, essentially, in the veterinarian's office. So we don't recommend that you do that. However, on occasion, the client is holding on to the animal, just basically touching the animal. And they will find that, and it's been found that people would come back in and want to hold on to their animal for musculoskeletal therapy, because every time they do that, they would experience within the next couple hours significant relief of their own musculoskeletal pain. This is called collateral health. Also, when we have our staff continually holding on to animals that we're lasering, we find that their skin would clear up, their musculoskeletal problems go away, their urogenital problems would go away. They would have the ladies would have very mild menstrual periods, essentially, and they would eventually get healthy, so they would endeavor to want to hold on to these animals, essentially. I also had one practitioner basically that found that he had hair like I did. I saw him about 8 months later, essentially had a full head of hair. He was in his late 50s and had been bald, essentially, like me for about, well, since he was about 45. The point being is, essentially, we end up with collateral health. How is that possible? Well, when we laser these animals, essentially, what's happening is we're utilizing this kind of laser, which has a 635 nanometer wavelength light that moves through the water molecules. So the body is continually inundated with water molecules, and so whether we laser this animal's hip, we can treat its eyeball. Whether we laser this animal's nose, we can treat its bladder if we have the right frequencies. And so it'll move through the body of an elephant, or move through the body of a flea, if you will, essentially because of the nature of the water molecule and the nature of this. By the way, that's why we only need 5 milliwatts. The body uses 3.4 to 4.7 milliwatts of energy. This is a 5 milliwatt device. And so we use the same wavelengths and frequencies that the body does. This one actually uses a violet frequency, which the body also uses too. So we can utilize this approach as a means to try to take care of this condition, essentially. And when we do so, if we have contact with the animal, believe it or not, there's enough contact just by holding the animal, even though the animal is covered with hair, that there is a communication through the water molecules of our body and our hands into our skin, through our sweat, through the hair, into the body, essentially, and the other way around too. So we'll end up with these animals actually responding to the therapy, and also these particular wavelengths get to us too. But if you've also noticed that the line laser that is unique for this particular type of laser allows a lot of scatter, essentially, and that causes the body to my body to absorb it too. So the health basically goes into the body of the practitioner, essentially, is a bonus, if you will, which we call collateral health. I would strongly recommend that you keep track of this, because if you start using these types of technologies, you'll find out that skin clears up, lots of chronic conditions clear up, gastrointestinal problems go away, and that you find that there's a spring in your step where you used to be kind of like a 65-year-old man that has difficulties running up and down the stairs after their kids. My point is those things start to go away. They go away relatively slowly, although one day you'll wake up and say, wow, that went away. And this is what we call collateral health. I'd have you basically look at this area in our on modules. We talk about it extensively in module on the basic and advanced modules as far as laser is concerned. And I would recommend you look into this technology, because its applications are potentially unlimited. Over 2,700 different disease conditions we've mapped out for this. And of course, collateral health is just a bonus. Thank you. Have a great day.